It's time to step up our anti-aging game when we're in our 30s and 40s. We head to the spa at West Glen for Hello Beautiful. We are talking skincare and the different stages of life. Today we're tackling 30s and 40s, which I'm super excited to hear about. Dr. Heidi Cook is here at the spa at West Glen, the owner and medical director. This has been so fascinating hearing about how our skin ages and especially what we need to do in the different stages. 30s and 40s.
30s and 40s. So this is the time where you really need to step up your anti-aging game.
Okay.
So there's a lot of the aging starts around 30. So a couple different things happen. One, when we're young, teens, 20s, our skin cells turn over every 21 days. When we get into our late 30s, 40s, that time doubles. So sometimes when you feel like you have a dull, not radiant complexion, you don't, because you have more dead skin cells waiting there, which also then accentuates every little wrinkle. So we have decreased skin cell turnover. We have a decrease in our collagen production, which is huge. So we also have a little bit of volume loss starting. So everything kind of starts around 30 years old. And so now is the time to up our game.
And how do we up our game with our skincare products? What products do we add?
Yep. So now would be the time to add in a growth factor type product. That one for me, my favorite is the Advanced Serum from Skin Medica. Oh. It is full, it's full of growth factors. What growth factors do, they communicate with the fibroblast in our skin to make more collagen. So that would be my number one suggestion, is that they should be on a retinol from their late teens, early 20s. They might want to use that a little bit more frequently, maybe 3-4 times a week. And then also, in addition to that, adding an antioxidant like a vitamin C is a good idea. Those protect the skin, but they also help repair also. So growth factor, retinol, antioxidant.
And still twice a day with washing.
Twice a day.
Moisturizing and everything.
Yes,
okay.
Twice a day.
What about any procedures or treatments to come in for?
So this is definitely when Botox comes into a bigger play, and also fillers. So we are starting to see volume loss. We're starting to see wrinkles that aren't due to a muscle moving, so just from kind of collapsing skin, less collagen, that's where your fillers come in. Also really good to do anything you can to increase collagen. That may mean doing BBL, which is the broadband light treatment that we have talked about in the past, but also things like microneedling and Morpheus 8, which is the radio frequency microneedling. Those are all really good treatments around this time frame.
And what about facials? Is that something that can also add in?
It is, definitely is. And then, anything to get impurities out helps all the products penetrate better. So just a regular facial helps with that. But then there also can be anti-aging facials, which have certain ingredients that will help with collagen production.
And you've mentioned before, people can come in for a consultation and you can give them an idea of what would really benefit them personally.
Absolutely. Yeah, so they can sit down, tell us what bothers them, we can assess them, and lay out a whole plan.
Okay, yeah, such an important time, especially as our skin starts to age even more, right?
Exactly.
Thanks, Dr. Heidi.
Thank you.
And be sure to tune in on Mondays for Hello Beautiful in the coming weeks as we continue our aging series with Dr. Heidi. You can set up your appointment at the spa at West Glen by calling 515-316-2801 or go online to spawestglen.com. You can find so many helpful beauty tips and tricks by following the spa at West Glen on Facebook, Instagram, and Twitter. What you need to be aware of when it comes to your life insurance. Dollars and Cents is coming up after the break.